I'd like to welcome those of you joining us from the DMV, from New York, South Carolina, California, Louisiana, and a special shout out to those joining us from the United Kingdom and Australia. For those of you who may not know about us, the National Building Museum inspires curiosity about the world we build for ourselves through our programs and exhibitions. But that's hard to do these days since the museum is currently closed due to the coronavirus pandemic. We're moving our programming to an online format, including this virtual edition of the museum's Spotlight on Design series. For over 15 years, Spotlight on Design has featured architects, landscape architects, and designers of distinction. The series is sponsored by the Revada Foundation of the Logan Family, and we are truly grateful for their continuing support. Before we get started, just a few matters to address. This is a live program with Murphy's Law hanging over our heads, so you'll know who to blame if any technical glitches happen. If you have a question you'd like to ask our speakers, you'll find a Q&A button at the bottom of your screen. Send your question to us that way, and we'll do our best to get to all of them in the second half of the program. And now it's my pleasure to welcome tonight's Master of Ceremonies, Mistress of Ceremonies, forgive me. Susan Piedmont Palladino is an architect, professor, and the director of Virginia Tech's Washington Alexandria Architecture Center, Go Hokies, where she also directs the graduate program in urban design. She is a curator at the National Building Museum and the author of several books, including companion books for exhibitions and initiatives she curated, Green Community with Tim Manell, Tools of the Imagination, Drawing Tools and Technologies from the 18th Century to the Present, and Intelligent Cities. With Mark Alden Branch, she wrote Devil's Workshop, 25 Years of Jersey Devil Architecture. Her most recent book takes a fresh look at graphic communications, titled How Drawings Work, a User-Friendly Theory. It was published in January of last year. And as you'll hear about in just a few minutes, Susan's latest effort as curator at the museum is the exhibition Justice is Beauty, the work of Mass Design Group, which will be waiting for you all to visit once we open our doors back to the public. Susan is a graduate of Virginia Tech and the College of William & Mary, and has lectured on American urbanism, sustainability, and current issues in design. A former president of the Architect Designers Planners for Social Responsibility, she has also served on the board of the National Academy of Environmental Design and consulted for the U.S. Department of Energy's Solar Decathlon. She was awarded the inaugural Vision in Design Award from the Branch Museum of Architecture and the Washington Architecture Foundation's John Webenson Award for work dedicated to the public interest. It's been a long time since I've had a chance to say this. Thank you, Susan, for joining us again. Please welcome Susan Piedmont Palladino.
Hi, thank you, Paul. And glad to see everybody. Of course, I can't see you. If this were a typical Spotlight on Design program, I'd be standing at a lectern at the Building Museum. I'd be waving at all the familiar faces that I saw in the audience. But it's not typical. So here I am at my desk, and I'm in your home or your office on your screen. And I'm really happy that this technology is allowing us to reach a lot of people who could not have been geographically present for this talk. I had the chance to hear tonight's speaker, Michael Murphy, give a talk at my university at Virginia Tech several years ago, and he alternately inspired and challenged us in the audience to see design, that's our field, as a powerful instrument of social change if we could just let go of some of our know-it-all baggage. Or at least that's what I took away from the talk, and it's been with me ever since, which is why I was so excited that we were doing this project, this exhibition at the Building Museum. And I think that each of you listening tonight will also take away something. And I hope that something will inspire you to come back to the Building Museum when we reopen to see the exhibition, Justice is Beauty, the work of Mass Design Group, including a separate space dedicated solely to the Gun Violence Memorial, first installed at the Chicago Architecture Biennial. The exhibition includes drawings, photographs, videos of completed and proposed projects, plus the portraits and voices of the designers, the craftspeople, and the community, and the research initiatives that underline and inform the work. So before I introduce Michael, I have to thank our sponsors. It took a team effort. We have thanked the Kindita Fund, the CoStar Group, the Chan Zuckerberg Initiative, Studios Architecture, Arab, the Graham Foundation for Advanced Studies in the Visual Arts, John Means and Rebecca Ballard, Robert Holyman and Bill Keller, McInturf Architects, and Arendt's Landscape Architects. And the Gun Violence Memorial Project installation is made possible by the Everytown for Gun Safety Support Fund. And so now it's my honor to give an introduction to Michael Murphy, the founding principal and executive director of MASS, all capital letters, MASS. It stands for Model of Architecture Serving Society. MASS is an architecture and design collective that leverages building, design, research, and construction to become catalysts for economic growth, social change, and justice. Since MASS's beginnings, about 10 years ago, their portfolio of work has expanded to cover a dozen countries and spans areas of healthcare, education, housing, urban development, and commemoration. With work published in over 900 publications and their new book, MASS was awarded the National Arts and Letters Award in 1917 and also the Cooper Hewitt National Design Award that same year. Michael's 2016 TED Talk has received over 1 million views, and MASS's project, the National Memorial for Peace and Justice, which we will see tonight, was just named the single greatest work of American architecture in the 21st century. Michael is taught at Harvard, the University of Michigan, and Columbia. He's from Poughkeepsie, New York, and I hope we see some of that city in the exhibition. He holds a master's degree from Harvard's Graduate School of Design and a Bachelor of Arts from the University of Chicago. And so now I'm going to turn off my camera and turn the screen over to Michael. Please welcome Michael.
Thank you, Susan. Thank you, everyone, for joining us. That was such a kind introduction. I'm really energized to be with you tonight before the Democratic National Convention's third night. I'm sure many of you will be watching that afterwards. And thank you for spending some time with us here today. Just give me 1 second while I share my screen and I'll begin more of a visual presentation. And I hope everyone can see that. So thank you again. I just wanted to also, now that I know that we're in your living rooms, just hope that you all are staying healthy and isolated, protected, and we're thinking about you and thinking about your families. We're all going through so much right now. It's hard to know how to connect beyond the screen, but I do believe it is the kind of empathy that connects us all that is going to get us through some of this. I know we've all had kind of real opportunities and some positive silver linings through this terrible pandemic and also some horrible tragedies. I did want to introduce you to my silver lining, which my son was born in January. This is Wilde Murphy, named after my favorite authors, Oscar Wilde. And, waking up to his sort of oblivious joy every morning is helping us get through some of this as I sit in my in-laws' house outside of the city I live in. But I also have faced, like many of you, some terrible tragedy. My good friend and mentor, Michael Sorkin, was taken, one of the great architectural theorists of our time, was taken by the coronavirus early in the pandemic. And, I think about Michael a lot because of his commitment to fighting for a built environment that was more just, more socially aware, that had a hybrid practice model of a nonprofit and a for-profit entity that was attempting to always infuse through searing wit as well as real projects a commitment to a more just and equitable world around us. And I will continue to think about him as a sage and a guide to us to think about what we might do out of this, what needs we might find that we as a profession and as a discipline need to recognize in order to build the kind of society we want to build out of this. And we should turn back to his thinking because it is so prescient. If only he were here to help guide us out. It's something that keeps me awake at night. But I do want to press on that for a second. I think many of you on the line today probably are in the building or what we might call spatial disciplines, the architecture planners or builders, and let us not forget, or let us not recognize the kind of weight of this moment. We are in an absolutely foundationally existential moment, not just as a people, but as a discipline. Architecture and design is at an incredible inflection point. So much of our built world is now asking us to do more. And I think, it is important for us to kind of listen to that in order to understand what we're going to do and to build ourselves out of this. We often talk at Mass that the built environment is not a neutral thing, that it either helps us or hurts us, it heals us or it hurts us. And while I think this has been, to some degree, a polarizing provocation or a theoretical provocation in the past to suggest really not so much in a divisive way, but more in a way to suggest that we need to be held accountable, as well as take very seriously the impact that we have on the public, on our politics, on our society, by the decisions that we make within the built world, from the labor that we hire to the materials that we choose. These have long trails of impact and influence, and it is our responsibility within the building industry and the architectural discipline, I think, to take that incredibly seriously. But to some degree, I think people either somewhat agree with this or not. I think now with the COVID pandemic, however, this provocation is really fact. We are all, each one of us sitting in our homes, having the same spatial awakening. That same spatial awareness is touching each and every one of us across the globe, that the built world around us, these buildings around us, are either keeping us from access to clean air or the ability to breathe, basic fundamental right to breathe, or they're potentially injuring our families, or they're keeping us safe. This very simple fact that our ability to have access to clean air is mitigated by the buildings around us, I think that is so important to remember. And for me, I think I've understood it in an even deeper way, that breathing, our ability to breathe, is actually a spatial problem, is something that the space around us manages, mitigates, and challenges us to get access to. And access, of course, being an incredibly important word to think about. Who has access to the right to breathe? Who has access to that fundamental right before even the right to health or health care is the ability to breathe? If we think about breathing as a spatial problem, we suddenly tether architecture and the built environment out of the kind of theoretical realm of a potential impact or a theoretical impact on our lives to a foundational impact of our rights as citizens and as human beings. That the buildings are keeping us from clean air. They are allowing us to breathe or not breathe. This, for me, the gravity of this gives me incredible fear about what decisions are being made in our world, but also, I think, a sense of real responsibility that architects and designers have an incredible role to play in building ourselves out of this mess that we're in. The show that we have at the National Building Museum and much of the history of our organization is actually founded on the challenge of understanding how breath is managed, as clean air is managed through the buildings around us. And our first project engaged this very question around the management of, or the resistance to, epidemic disease of tuberculosis, another airborne disease, much like COVID, as we now know, aerosolized, transmitted through the airborne route, and infecting people as they go inside of buildings. When I was a student of architecture, I was wondering where so many of these opportunities were. in the world? Where were architects having the kind of impact that we heard they possibly could be having? And it clicked one day when I met at a lecture this amazing Dr. Paul Farmer. And Dr. Farmer runs an incredible global organization called Partners in Health that serves some of the poorest communities around the world. And Dr. Farmer was talking about not healthcare, but architecture. We're building hospitals and clinics. We're building housing for people. But he wasn't talking about housing as an architectural problem. He was talking about it as a healthcare problem. And then he said, but where are the architects? We're doing all of these things by ourselves without the services of the professionals trained to do them. Where are the architects? Why haven't they stood up and found a way to support us where we are and where we have the most need? And in particular, he told a story about a hospital in South Africa called Tugela-Ferry, where the outbreak of extremely drug-resistant tuberculosis emerged in 2005. This hospital, much as the stories we hear now today, had an outbreak of this disease, and it was largely because patients were sitting in unventilated hallways such as this without proper airflow. One person was sick with an infectious disease, coughed on another person was immunocompromised, contracted the disease. They co-infected with resistant strands of disease, creating a hybrid multi-drug resistant strand. And now this story, which kind of drove a decision around how do we design hospitals that have enough airflow to reduce the transmission of TB, of course, is very prescient to our conversations today. I'll come back to that. When I met Dr. Farmer, he invited myself and others to join his team in Rwanda. I worked with their entity in East Africa and Rwanda on various building projects my first summer of architecture school. And then when the opportunity to emerge with a new design of a hospital, emerged, and he asked us to assist their organization in developing it. And so the first project, the Butaro Hospital, I'll talk about, but I wanted to go a little bit backwards and talk about where the ideas came from. We were forced to ask, how does a building breathe better to reduce infection? And we looked back to old tuberculosis sanatoriums of the past. The Pineal Sanatorium by Alvar Aalto is an incredible precedent that many of you may, of course, know. I won't go into it for too much detail, but I would say that this building, this paradigmatic building, which both is part of the canon of modernism, but also something else, part of a canon of buildings directly affecting the health of their inhabitants, so I think should drive not only the design of the Butaro Hospital, but drove our thinking to today. And I've been very encouraged by the resurgence of inquiry into the sanatorium, the Piedmont Sanatorium, and other TB sanatoriums across the world that were built at this period of time, built before the introduction of mechanical ventilation and climate control systems, largely, or the wide adoption of them. And so this building designed to maximize airflow introduced large outdoor areas for the treatment for sick patients, other strategies like very thin floor plates so that that couldn't be added to in difficult ways that would disrupt the airflow strategies of the building, and even everything from chairs designed and sinks designed around health outcomes, around impacts on people who are suffering from this specific disease, reminded us that that architecture and the design, if driven by a singular idea of the improvement of health, and in fact an effect on the body, would lead to decisions and designs that could trickle all the way down to even the signage, the graphic design, and we see that in the sanatorium that Aalto designed. It's so influential and so important. This was a reminder to us that the architecture performs. That it's not just it's not this question of form over function. It is, these things are intertwined. And the building, for it to be successful, has to perform around airflow management. Well, in Rwanda, a small country in East Africa, emerging out of horrific genocide in 1995, this country rebuilding very rapidly had an aspiration to have not just good enough medical facilities, but the best that were possible, and charged Dr. Farmer and his team to build that. So working north in the country in a very rural area, one of the most underserved area of the country, incredibly beautiful, but very hard to access for healthcare services. we designed and developed the Butaro Hospital, which opened in 2011. The design of this hospital, much like the Pineal Sanatorium, is designed around airflow moving through the facility. It is designed to manage and mitigate and reduce infection. And it's cited very specifically for its microclimate upon this hill. The idea of hallways, where we saw patients getting sick in Tugela Ferry, these undesigned spaces for circulation that are used in ways not designed for them, moved all hallways to the exterior. And then importantly, in the collective wards, thought about how we could get enough airflow, anywhere from 6 to 12 air changes per hour, a discussion that we're having now in many spaces around the country, around the world. How do we get enough airflow in spaces not designed for that? This was the design driver of this project. Here in this collective ward, we're getting over 10 air changes per hour, the right amount to manage epidemic disease like TB from transmitted, or COVID for that matter. But we're also adding things like UVGI lights and low velocity fans in order to bring air into the upper room, in order to cleanse it for equivalent air exchanges. But other things emerged in this design, the view of a window, data showing that patients get healthier if they have the view of the outside instead of the view of other patients. Here, the kind of idea of a centrally loaded corridor or a hallway around the beds with a nursing station in the middle, the kind of perspective of the patient becoming central instead of the perspective of the doctor being central. Simple things like this drove much of the design about the experience of healing, about the experience both as our body and our souls and our community are thought about as an opportunity to use the architecture to manifest a healthier environment. We've been overwhelmed with the kind of outcome of this project, and it sits on this hill, and of course architecture isn't just about the airflow moving through it or how it performs, but also what it symbolizes. And the stonework of this place, mined from the ground, building up this foundation almost of this fortress, which brings people up onto the center hill, is symbolic of the opportunity we have to invest in all of the resources around us, and made us and reminded us to think about every design decision as an opportunity to improve and affect and invest in place, the creation of places, right? The thing that architecture, so if done well, frequently can optimize, right? A commitment and a creation of something unique and wholly singular that reminds us about how much we have not been thought about in so many other built environments around the world, in the rest of our community. This hilltop has since become really our muse, but a place where we've continued to stay. Our team of a few architects working within the organization Partners in Health then grew into its own practice, first established in Rwanda in 2010. And since then, we've continued every year to work on this campus, building additional facilities, additional buildings, and continue today, where a new university has been completed. Now our team in Rwanda is 85 people, mostly of either Rwandese or East African background, building a number of new projects that take these same principles that we learned at this first project into larger and larger strategies and tests. Like here, the Nyarugenge Hospital to be completed this month, which is policies based on these early airflow strategies. Here it is, a photo, not yet quite professionally photographed, but almost in completion, and already taking COVID patients in Rwanda, a country which has managed its contamination and loss of life better than most countries in the world. Here we see some of the final images before it is open. Those same healthcare designs have also brought us, of course, across the world, working in places like Bangladesh, but even here in the United States. This new clinic in McKinney, Texas, north of Dallas, will open also this fall. This is a kind of a different type of healthcare setting, a community health center. And we're very excited about this, using very similar principles, very different climate, but strategies about serving the most underserved, investing in place, and creating a kind of material palette from this area. That work brought us into other epidemic disease. You'll see a kind of theme throughout this presentation about designing after disease. The outbreak of Haiti, the outbreak of cholera happened in Haiti after the earthquake of 2010. And we were working with the same organization, Partners in Health, who had their primary work in Haiti, and other partners asked us to support them in thinking about a tuberculosis hospital, the same disease we managed in Rwanda, but then also when the cholera outbreak emerged, a new center for the treatment of cholera. I want to back up again to think about the relationship between public health and design. Many of you may know, of course, the John Snow map of Soho in London in 1858, I believe is the date. And Snow had a hunch that cholera was not a disease that was morally born from the poor, which were largely contracting it in more dense and kind of polluted neighborhoods, but that there was some other reason for its rapid contamination. He mapped these hatches on the street and saw a tight conglomeration around, of course, the famous water pump, and went to the water pump, saw that the water pump underground was having waste pumped into the water source, and discovered that cholera was waterborne, not morally born. The beginning of epidemiology and really kind of urban design and all of these confluence of disciplinary strategies emerged to solve health crises, and architecture and design really advances significantly. It evolves rapidly at this moment in time as we see the spatial disciplines as necessary to solve public health crises. Of course, with that and the emergence, the challenge, the miasma theory of health outbreaks and other advances in medicine become successful in treating disease like cholera. And by the end of the 19th century, to a large degree, cholera is mostly eradicated around the world, not completely, but to a large degree it is. And then slowly over time, these connections between health and design start to diverge. And we start to see cholera outbreaks again, not just in Southeast Asia, but in South America, and then in Africa, and then of course, in Haiti, the largest outbreak of the 20th century happens in 2011. So, I think these are some structural questions, but there's also some basic foundational architectural questions, like why is it that we have failed to be able to maintain and control the disease? What are the design problems? What are our spatial problems that have kept us from doing that? Why has it emerged so virulently again today? And how do we start to address both the immediate crisis and the long-term structural issues related to diseases like cholera in the ground and the contamination of our water? Dr. Bill Popp, who runs an organization called GHESKIO in Haiti, the largest healthcare provider in Port-au-Prince, engaged us to help think about a new cholera treatment center, the first permanent center in the city, to both manage the immediate outbreak and the long-term care of patients suffering from diarrheal disease. I mean, diarrheal disease is already the #2 killer of children before the outbreak of cholera. So here we have a kind of acute on chronic condition, an acute disease on a chronic condition that we want to, solving this might solve many other problems. I like this image, really always inspires me and challenges me. You can see the cholera clinic in the middle of the page, and it sits on a highway or a road. That boulevard is called Harry Truman Boulevard, named after the U.S. president who was president when this was constructed by the Army Corps of Engineers, the U.S. Army Corps of Engineers, and it was constructed on the water's edge at that period of time. And so all of that neighborhood, all 70,000 people that live in what is now called City of God, have emerged since the 50s, since the construction of that water boulevard, that boulevard on the water, that promenade for ambulation and evening sunsets, and the gridded city of the historic older Port-au-Prince on the left, and the ungridded city on the right, really represent, I think, a snapshot of the cities of today, where planning and a lack of planning are emerging together. where subterranean infrastructure and no subterranean infrastructure overlap, where diseases emerging in one part affect diseases in the other, regardless of control of the built environment around us. These things are our present condition and must be considered the broader context if we're going to think about one specific architectural intervention. And so we pushed beyond just building a shelter for patients to really think about that structural problem. How do we start to address the systemic condition of waterborne disease? And so we asked if we could lift the building up and build a large series of tanks underneath the Cholera Center to collect all of the contaminated waste and then decontaminate it on site. Instead of relying on the piped subterranean infrastructure of the city, create an independent decontamination center at the hospital site itself. Something that, if replicated, could start to address more regionalized decontamination strategies that kind of localized versions within the city could manage. In 2015, we opened the Cholera Center, and its design is really based on a number of things, but again, light and air moving through the facility, very low maintenance and highly flexible and resilient. But in this case, the materiality is not the stone from the ground, but the kind of upcycled metal that's used in this case, local taxis, the tap-taps. You can see this kind of vibrant exoskeletons, as well as other beautiful, ornate, famous Haitian metalwork that you see all over the country and all over the Caribbean. So the same artisans joined us to develop a facade system based on 36,000 individually cut panels. In addition, other collaborators like Herman Miller Furniture Company brought designers to Port-au-Prince with us to forge easily replicable and locally sourceable furniture for cholera patients. This is Mackenzie Ville, who is the artisan who really led the metalwork effort, and the tap-tap that folks in the design. And I think here again is a question not just not to fetishize the local in a way that every material is sourceable from the ground. In Haiti, the vast majority of materials are imported. Very few are local, a kind of deforested countryside. For example, keeps us from sourcing wood locally. But there are other innovative ways to think about material choices which maximize investment into, let's say in this case, artisanal workshops and local job creation. After the work in Port-au-Prince with a team there for 5 years working on this and other projects, of course, the next epidemic disease of Ebola broke out in Liberia. We had been working with the government, the Ministry of Health of Liberia, since 2010 on planning strategies for a national hospital. But when Ebola broke, the ministry was facing not just obviously incredible crisis of disease, but also a crisis of international aid, prioritizing, of course, relief, but to some degree, strategies that they felt were the priority, not the ministry's priority. So urgent emergency tents were popping up, and the government wanted to invest in long-term infrastructure as well to solve the kind of potential future crisis that they might see. I wanted to bring up another pair of incredible mid-19th century heroes of ours. It's Florence Nightingale on the left and Isambard Brunel on the right. Brunel, the great engineer, Nightingale, the great designer and thinker and health practitioner and innovator. And the story of the Rancoy Hospital was really influential here to us and continues to be an inspiration. In the Crimean War, patients were dying from famously the bell tents that they were forced to sit within, dying of so many different diseases at a higher rate than they were dying on the battlefield. And Nightingale was a nurse there, and summoned a call where a challenge to develop a hospital which might address an urgent emergency tent hospital, which might address some of this contaminated disease, killing more soldiers than the war was itself. Famously, Brunel develops a flat-packed hospital put on trains. The Renkoy Hospital is sent to what is now Turkey, erected, and the rate of death drops by something like 75%, if I have that right. Simple strategies of cranked air to move still air through the building, kind of a mechanical crank that people would operate, lifting the building off the ground to get airflow through the bottom underneath and around the building, light and other strategies, simple, very, very simple spatial strategies, had massive and transformative health effects on the population. These should all inspire us and also remind us about that things like emergency, urgent tents are never really, or temporary, never really temporary. These things have permanent impacts on place, not just on outcomes of health, but on the investment in something that we consider maybe impermanent. Well, a lifespan of a building, we must consider a sort of organic lifespan of it. And you know, some of these emergency shelters last for a decade or more, as we know from some settlements around the world. Here in Liberia, we warned about a very similar thing, which was that we wouldn't want all the money going from international aid into temporary shelters to treat Ebola. While essential to stem the bleeding, a long-term infrastructure was necessary to address the chronic conditions. And so we worked with a range of different folks, everything from going to RISD for design charrettes with the School of Design at RISD, to working with the Ministry of Health directly to fight for more aid distributed directly into a new tertiary care facility in the country. The Redemption Hospital, again, designed around these ideas of natural ventilation, but in this situation, forced through a series of solar chimneys we developed with the Trans Solar out of New York and Stuttgart, who are incredible innovators in environmental design. And this contextually driven, hyper-resilient, disease-specific medical facility is intended to not just manage things like Ebola and the separation of patients, but also future outbreaks that we might see that are airborne, like COVID. You can see this here, the multiple chimneys required for climate such as Liberia, one of the wettest climates in the world, also very humid, and allowing for various different strategies that we would think about the architecture of managing and manipulating a unique microclimate of comfort, of also airflow, and of also healthy spaces. All of these things have driven our design strategies from the beginning, thinking that the building itself performs always. So we might as well consider it performing directly for outcomes that we seek and that we know we need. Spaces that make us healthier, really foundationally, spaces that allow us to breathe. This is under construction now for completion sometime next year. I talk about all of those things because I think, now we are in this moment where many, and I've heard this from many architects, have asked, what we know we need to contribute. The buildings around us, all of them, from hospitals, of course, but to apartment buildings, to schools, or schools maybe is the most important linchpin, to restaurants, of course, nursing homes, carceral facilities. These are all directly affecting the health of our communities. And it's the buildings that we are suffering in, which might be the reason why you might live or die. It's certainly the case where 75% of deaths in New Jersey, for example, are in nursing homes. I'm glad we have people from around the world on this call because the condition in America is dire, as I'm sure you know. And to some degree, building our way out of this is not just about 6 feet of separation. It's about radically rethinking our relationship to the buildings around us. And while there have not been guidelines developed or they're being developed as we speak, and the CDC to some degree has been fast and slow in pushing for a recognition of things like aerosolization, which of course is spatially determined. I think we all know that we all have a hunch now that we understand a little bit more of the disease, that the buildings around us will determine whether we have access to clean air or not. And that is, again, an existential opportunity and crisis. It is one which cannot be fixed by simply throwing more or turning up the HVAC system. You might increase airflow or air exchange by 1 or 2 percentage points. It cannot simply be solved by just opening windows, although that is one strategy, as we know. It has to be solved from a comprehensive rethinking of what we build, how we build, what we measure, and what we prioritize. I've been constantly reminded that this foundational question to me keeps emerging. Why is it that we allow the flu every year to not only get all of us sick, but kill between 20, some say 40,000 people a year anyway? Why is that an acceptable baseline, that our buildings are also contaminating us every year annually and also causing great suffering and harm? Shouldn't we be prioritizing the health of our public, especially our children at school, especially our most marginalized seniors in housing, especially those which don't have the control over their built environment that they so need? So we, as an organization, have been rapidly engaged in a number of, I would say, not so much guidelines, but case studies to show where our guidelines from infection control and these other examples can be deployed in specific typologies like senior housing, like hospitals, like emergency tents, like restaurants, and now like schools, which we're working with the Cambridge City School System. And one interesting opportunity as well emerged where we were working directly with the Mount Sinai Hospital in New York at the middle of the height of the surge in New York City, helping them with GoPro cameras and various different Zoom-based technologies to observe, to watch, to monitor, and to evaluate how their spaces were adapting or having challenged to adapt to the very, very urgent needs of the outbreak in the middle of the pandemic. And I think some incredibly sobering structural problems and realities emerge from this, which is that our hospitals are not designed necessarily for outbreak. They are designed to fill beds. Those business models are different than a kind of resistance to pandemic. And then, of course, other great tales of heroism and commitment from so many healthcare workers to fight for the lives of those who were brought in here, and great success. And Mount Sinai deserves incredible credit for what they did, rapidly changing all the time. And it goes back to, I think, what I learned from Dr. Farmer in that first lecture, which was these doctors, these nurses, these healthcare providers are making design decisions every single day in these hallways, in these spaces, in these rooms, hacking together airflows and airflow systems and filters, and trying the best with whatever tools they have to create an environment, a safe environment, a healthy environment, a breathable environment with as little information as they have to protect themselves and their patients. And so those design decisions, those moments in my mind, are the kind of opening for architects and designers to get proximate, to get in there and to address through our discipline and our training other strategies that might assist even in these urgent on-time needs that we're seeing today. I wanted to bring up just Dan Barber and his incredible new book, who talks a lot about some of the roles that the architecture in the past has dealt with managing airflow before air conditioning, and a shout out to him because he's been great, very informative to me recently. The last project I'll talk about here is happened actually it emerged at the opening of the memorial in 2018. These two amazing women, Pam Bosley and Annette Nons-Holt, approached me when I was in the memorial and asked me if we could have a conversation and talk about a memorial to their children who were both murdered by guns in America, that we needed a memorial and a series of memorials to the gun violence epidemic in our country in order to end it, to address it, to stop it. I remember that as one of the most profound moments of my life, to hear the stories of Terrell Bosley and Blair Holt, these two young men who, one going to band practice, the other on a city bus, just in the wrong place at the wrong time, killed on the streets, in this case in Chicago. And these two mothers consumed and energized to build a coalition to fight this and to bring attention to their children, but also to represent and protect others from this happening in the future. We know the story. We know the stories in America. Of those who don't know this, it's horrifying. We have reached 100 people a day killed by guns in America. That's over 3,000 people a month. That's almost half of all Americans know someone who's been shot by firearms. And I think Pam says it best. We heard these numbers, we rattle them off, but we don't ever get to see who our children are, the names and their visions and their dreams, who they were as people. And that is what's keeping us from understanding and building coalitions to change the policies and end this epidemic. And another, of course, real epidemic, some have called the epidemic within an epidemic, that we are in now as people continue to die from firearms in America. How to design a memorial of a current epidemic, we might ask during COVID, but we can also ask during the gun violence epidemic, is a different question, something that is constantly happening and constantly adding new names. So we were inspired by the great project, the AIDS Quilt, the Names Project, which addressed the epidemic of HIV, of course, in the late 80s and early 90s, and many credit with really changing the public narrative around the insufferable death that was happening to so many people from the disease then. Changing policy and getting to a place now where we have, at least for some communities, started to address how people can live with this disease. In the late 80s, of course, that wasn't the case. And so activists asked loved ones to fill one panel and then make a giant quilt and cover the National Mall. And when you see it, as you do here, 90,000 panels, 90,000 names, stories, unique, individual, intimate portraits of people lost, but also the feeling of this spatial takeover. I mean, this is larger than any other memorial on the mall, of course, at this period of time, and this happening. It is a sense of the infinite loss with the intimacy of being able to touch one of these individuals. This drive towards empathy, through culture change, changes policy. That profound idea that first through culture, we then change policy, is what the AIDS Quilt, I think, is a testament to. And I hear an inspiration for what we might think about for contemporary epidemics and how we capture the loss, but also generate and drive momentum to get out of the atrocities that we're within. So our idea was very simple, an object collection, where we would ask loved ones to give us an object, commit something, at least lend us or donate an object of their loved one, and then we would encase it in a glass brick, metaphorically, and then from those build glass houses. Each house commemorating a group, a state, and then eventually building houses all over the country. And we started to do this in Chicago last year at the Architecture Biennial in the hometown of Pam and Annette, and started meeting so many of these mothers and friends and fathers and collecting objects about their loved ones and hearing their stories about their loss, about the life that they lived, about their dreams. And then through that object, giving it space, equivalent space as others to be able to kind of create a punctum to the individual life. And then those glass houses, we built 4 of them in the Cultural Center in Chicago on Michigan Avenue, and started to collect now over 500 objects and continue to collect them today. These houses will be in Washington with more objects from more stories around the country. Each one a new narrative, each one a life that has been forgotten and erased, but is enlivened and empowered by placement in this collection. The story of Blair, for example, here through images and a badge for his school. Hair clippers, hats, t-shirts, a cigar, various objects abound in here, and each one a different story, each one an opportunity to ask a question about how and who and they lived and why they were lost. Our goal, though, is bigger than this. Our goal is in Washington for you all to hopefully see this and inspire its growth around the country. We want to build one for every state in America, and also one for Washington, one for native lands and occupied territories. And in 3 to 4 years from now, to build 52 of these on the National Mall itself, and have a march on Washington to address the epidemic of gun violence and to end it once and for all. You know, as architects and designers, I think we often are waiting for the RFP to emerge, for the opportunity to be given to us. And here is an example where, with Pam and Annette and with others, the need emerged in the question: how do we commemorate the loved ones that are lost? Well, we do so by thinking towards the North Star, towards what might be possible to replicate and change policy. And doing so would be something bigger than we could even design for, bigger than we could commission, but just one has to do. When you think about it, we have to do this. So this on the horizon, hopefully inspired by what you see at the National Building Museum, and be a part of this, hopefully all of you collectively. I'll end with just, you know, where we are today. Our streets are being taken over and rethought. And I go back to ideas of Michael Sorkin and others who imagined one day we would be able to take back our streets and reconsider them as spaces of not just reclamation, but health and healthy eating and healthy transportation and healthy living. And we are grateful for so many who have built this movement, so many leaders and thinkers, like some of you on the phone on the call today, who have inspired us, and so many in the future who hopefully will be carrying the torch to reconsider our built environment as an opportunity and a necessity to fight for justice. So thank you very much.
I would applaud loudly, and I'm sure there's people who are listening. I think we have almost 150 people out there who are probably applauding loudly in their own rooms. Thank you. That was moving and beautiful and provocative. And a couple of things. You mentioned the future, the sort of passing the torch to the next generation, which is interesting. I was scribbling notes. Of course, you and I talked earlier. I had all these pre-written questions queued up. But of course, I was scribbling notes while you were talking, and I wrote down breathing is spatial. And I was struck by how breath underlies so much of this work. The idea that we have a right to air, right to a safe environment, and breathing is political, from COVID to Eric Garner to George Floyd. And so this dilemma of air is kind of profound. And I was scribbling, and then we got a wonderful question that's much more succinct than mine, that came in from a high school student who is attending, Pitua Mukimbo. And Pitua wants to know where you see architecture and building and memorial design going in the future, especially concerning issues of climate change and increased globalization, and how those things might begin to intersect with what you're doing.
Well, thank you for that question. Thank you for attending. Glad to hear from people in high school who are inspired and motivated. Today I only showed a few projects, but you know, I would say that, of course, if we take breathing as the foundation, I would call it a higher order of the spatial rights, the highest order. It is the foundational thing. Without breath, as an asthmatic, I feel this every day. Without breath, there is no life. There's no access to life. And so I believe we can think about it in multiple scales. And I actually think one of the problems we have in the spatial disciplines is that we fuzz scales all the time. We need to think really critically and talk critically about scale. So there's the scale of the body, how the body breathes. There's the scale of the community. Access to clean air is something that public health can also address, right? And then I think, to your point, the planetary scale or the regional scale, where the access to clean air, the ability to breathe that's not contaminated by large-scale corporate pollution contamination, the contamination of carbon in our air, the destruction of the environment through the building trades and the built environment itself. Of course, you may know that almost 40% of carbon emissions are because of the built environment. Some say almost 50%. So with infrastructure and the built environment being one of the primary pollutants and contaminants of carbon in our atmosphere, the decisions that we're making every day about what materials we choose also are having effects on our ability to breathe clean air in the future. One of the arguments that Dan Barber makes in his incredible book, which I do recommend, is that, of course, as we think only about comfort of ourselves and not discomfort, but comfort of ourselves, and have increasingly tried to cool what he calls the planetary interior of our spaces, we, of course, are simultaneously heating the spaces outside and affecting the lives of others in our planet. So every decision in the built environment has impacts physically, regionally, planetary. And we do our best work if we're able to bind those together in a narrative of accountability, but also of intent, I would say. Like, we intentionally are making these decisions with the best knowledge that we have.
Yeah, to sort of keep going with that question about air, and I'll again meld one of my questions with one from the audience. I was struck by your discussion of John Snow's map, which is one of my favorite sort of data visualizations, and a lot of people say that's really the first data visualization. You talked about Florence Nightingale's work. She really was doing what we would call evidence-based design. And so back in the 19th century, there were people doing things that we now have names for. And it was at that time that design and public health, landscape architecture, urban design, and architecture had a really close, in fact, helped birth the whole idea of public health. I sort of feel like we're back in the 19th century in some ways. And that you could say that modern medicine, particularly the development of antibiotics and mechanical systems in buildings, have allowed us to forget those profound connections. And so I'm curious about expanding a little bit on what we've forgotten and where you see that future, where recovering some of this knowledge from the 19th century. And I think our question from Nia in the chat was, how, with the design experience for some of these medical facilities that you did pre-COVID, how is this design experience now going to be different? Is it different? So there's a lot in that question, but it does have to do with how we design, not just after disease, but can we return to some ideas that design can actually mitigate and prevent disease?
Yeah, thank you for that. Well, one of the reasons I did bring up so many of these legends of the 19th century is because, just as you say, Susan, thank you for bringing that up, that at that period of time, there was an incredible confluence of disciplinary knowledge working together to solve foundational questions of public health. And disciplinary guideposts were not really evident, right? They were emergent. Epidemiology, public health, urban design, they emerged from the question, the foundational question of how do we solve a health crisis? Well, I think now we're asking the question backwards. How does my discipline solve a piece of this issue? We need to ask the question the same way they did 150 years ago. How do we collectively come together to solve the pandemic? And what will emerge from this is all new, if we ask the question the right way, amazing and I think fascinating forms of practice, of collaborations and new innovations potentially. So I do think we need to look back in order to understand where we're going in the future. And the kind of the separation of our disciplines has caused, great problems. In other words, we can't actually control our built environment as much anymore because we've outsourced it to mechanical systems and technologies that are already now predicating the buildings around us as being defined by them. We can't actually break them or hack them. We have to, we're looking in the schools that we're looking at schools built before mechanical systems as the ones that might be more adaptable to COVID, instead of the ones built in the last 50 years, which are less adaptable. And so here I go back to a lesson from, I think, Florence Nightingale, who then from that went to design guidelines for the Nightingale ward and hospitals around the world. One lesson we might learn from them is that buildings are living things. I like to now think about a building as like an iron lung, or like lungs themselves. They are living things. They're verbs, not nouns. They're not fixed objects. They're processes. If we consider them in that form, then we wouldn't ask them to always perform in the same exact way. We would all the time. We would expect them, and this maybe goes to the second question, to be working with us and adapting with us for the needs we have as they change. And that would be the case with COVID. If buildings were designed for, let's say, the common flu that happens every year, they would actually be quite adaptable to COVID and other airborne diseases. But because they're not designed for health, they're designed in some cases to resist active shooters, which is the case in the new school design in Connecticut, or we're seeing in more school designs to resist shooting cases instead of resisting epidemic disease or the common flu. We have a less resilient system. So I would say that's one lesson. And second, I think to your early point is that disciplinary boundaries are really keeping us from thinking about innovation. We need to be questioning not just what we design, but how we practice design in order to answer some of these harder questions that are interdisciplinary.
Yeah, and I think this question, and this was also a nice overlap with mine. We have a very attentive audience. This question, Paul Farmer, you showed the slide, Paul Farmer asking, where are the architects? In this conversation about designing for health and for COVID, in the COVID briefings, one might ask, where are the architects, right? Where is the voice of design professions? But in talking about, and this question you often ask is, what more can architecture do? What more can landscape architecture do? We have a question from the audience from Carrie Thompson, who wants to know about sort of all of the other forces that influence architecture, going back to requests for proposal, for clients, and for asking for these things. And Carrie wants to know, how do we better inform and incentivize those who play those pivotal roles? How does the sort of education of the client, the citizen, is this where research comes into play, the research that you do? What more can architecture do about that?
No, I think that's a great question. I mean, we often say that once the RFP, the request for proposals, for those who aren't architects out there, emerges, we're usually too late for architectural innovation. Some of the decisions have been baked already upstream. And if you are an architect or designer out there who's responded to an RFP, I'm sure you've realized, sometimes they're right, but sometimes you're spending much of your work designing the problems that the RFP didn't actually recognize or know how to solve. So our solution to that, I think, is actually to go way upstream. The problem with practice right now is that we're completely beholden to a marketplace which is already actually eliminating the great service of design innovation in favor of packaged RFP service that will then become a building. Instead of saying, how can designers help craft and think about what the appropriate spatial response would be to a series of challenges that we're facing? That is to say, I believe the best work that we do is really in spatializing the problem and the challenge towards a solution that is based on the specific climate, microclimate, and context in which it's in, but also is cognizant of, let's say, global or regional challenges and trends that are affecting its possibility of being constructed. So we as a practice, and we're configured as a nonprofit organization, intentionally are configured that way to address that structural problem of practice, to go upstream, to work with partners and clients, and we really call them partners because we see ourselves as a partner in that, to help isolate and understand the spatial problem and try to determine if a spatial solution, if a building solution is actually what's necessary in order to solve that. And if it is, what decisions need to be made down the process to kind of go way upstream. And I think, for practices moving forward, for designers moving forward, if you're asking, what can we do? I would say go upstream, go back to your hometown, go into those rooms where no designers are asked to be at the table, and be at the table. See where you can be of service, volunteer your time to agencies that need your help, just start being present and proximate, and the spatial decisions and the spatial thinking will immediately emerge, and you'll be able to catch it because you've been trained in that way. Much like in the case of Mount Sinai, doctors are all the time making radical spatial transformations of their space without the support of architects. Now that's just something that happens every day, and we can learn a lot from those decisions, but we can also be a guide, an ally, and an asset to making those decisions maybe be more comprehensive, more structural, more considerate, or sometimes ourselves learn what we have done wrong, what's been a problem in the spaces that were designed, so that we don't make those mistakes in the future.
Yeah, I mean, in a sense, that question of what more can architecture do, you're challenging our definitions of practice and the profession, if I'm hearing your answer correctly, which is sort of expanding what it means to have a design practice and how we actually design, how we actually think of ourselves as professionals. I don't know if, so instead of being a reactive profession, we actually become more leaders in addressing these questions.
Yeah, I think one of the great theoretical problems that's happened in the last 50 years is that we've made it a choice for architects to decide. We've assumed there's a choice that we have, where you can decide to be let's call it a social practice, a practice which cares or considers or focuses on impacts of the built environment on social effects, or like a normal architectural practice. That division, which is always to some degree been talked about, between the impact we have on our communities and the ability of the architect to express him or herself as an art form. I would say, and others have said it before me, that is a false division. That is a false dichotomy. We need to eliminate the idea that one is opposite the other, that the two are actually incredibly intertwined, that every architectural spatial decision you make has some social, political, or environmental effect. It just does. It's not a question of whether it does or not. It's really a question of whether we are acknowledge it, are aware of it, are comfortable with the power of that decision, and are addressing the kind of inherent complications that are infused with that kind of moral responsibility. And in the past, I would say, especially at the turn of the, in the late mid-century, when architects, in 68, I've been thinking a lot about 68 recently, of course, with the political protests, the global upheavals, the social change that was happening, and architects then too were being blamed for so much of what was happening. Modernism failed, big visions of housing for all and the utopian aspirations were kind of behaviorist control mechanisms that marginalized people. There was a lot of narrative around the failure of architecture and planning and design, much of it, some of it very destructive, of course. But instead of saying, we want to evolve and evaluate and measure where it has been bad and has been good, has been successful and unsuccessful, and push forward, we created a separate project where we washed our hands and removed ourselves, the autonomous project of architecture. And many political architects at that time also said, architecture is a weak political tool to change power relationships. We should abandon architecture altogether. So many kind of left the trade and said, we're going to move to planning or move to other disciplines where we might have more impact. And I think we're at that same existential moment. I think what you might see in the next 3 years are either architects digging in and designers digging in and saying, we are responsible, but also we can hurt and we can heal. We're responsible, but also we can play a part in evolving out of this and in building out of this crisis. And we need to be comfortable with that weight of that complicity of power, but also open to the possibility of change. Or we're going to see a disciplinary fracture again, where we abandon it altogether and try to be artists and when that happens, capital designs the built environment around you. And it is where we are today.
We have just a few more minutes, but I don't want to end on that statement of capital is going to design the world. We're sort of commemorating with this exhibition sort of a decade of mass work. And I feel like a public radio host in the remaining 2 minutes we have. I'm going to give you just about that much time. Where you see next 10 years for mass, is there anything that you haven't done, any research you haven't gotten the chance to tackle, that you are hoping, planning, intending, wanting to wrestle with in the coming years?
Yeah, I mean, thanks for that. Well, we've been thinking a lot about where else we as an organization and as a discipline need to think critically. And so we've established in the last year what we call the mass labs. And those labs are research topic specific portfolios led by other members of our team. We are a collective of various principals leading different portfolios. And, there are a couple of areas where we think there's profound work to be done that have impacts on the spatial world. One in particular is around food systems. I think food and the impact of our what we grow on our environment, on our planetary health, is at an absolute fundamental inflection point. And the architecture of food, the architectural decisions that we might make spatially to influence or affect or understand how the things that we choose to put in our body at least 3 times a day, that decision we make every single day, multiple times, it's a long trail of effect on communities, on our planet, on access to basic economic and social rights. Food, I think, is a powerful lens through which we might understand our responsibility as architects in the future. So we're looking hard and deep at that. My good friend and colleague, Caitlin Taylor, who I taught with at Columbia and joined Mass, has been really enlightening me. She's a farmer and an architect, so another cross-disciplinary person, and really been informing me about how to think about food systems as an architectural problem. So that's just one of a number of labs that we've set up. And we're open to others. We're heavily involved in questions of climate change and carbon neutrality in our buildings. I mean, you'll see from our work that it is significantly about local impact, what we call low-fab construction. Next year, we'll open the Rwanda Institute of Conservation Agriculture. It's a 52-building campus that we've designed from the ground up. My colleague Alan Ricks and Kelly Doran have really been the leads on that. I'm Christian Benimana in Rwanda. And that building will be climate positive in 10 years. It will have, its footprint is one of the lowest in the world. Every decision, every material, every planting that we've added to has been heavily, heavily designed around trying to be a lighthouse project for thinking about not just individual buildings, but entire campuses in the future. And so we want to share that. And then, there's other projects I didn't talk about tonight that are on the deck, but I'm happy to share in other ways. But I would just say, to kind of close, I hope in 10 years, it's important to build, I think, as architects, to have a thesis constructed and manifest spatially. It's important for us to say, hey, there's an idea that then will be a building, and we can see if it works by looking and testing and feeling and understanding in our bones that building. But there still is the development of ideas that is necessary. And I don't think it's possible to continue to focus on the core issues of affecting our communities and our environment without practices changing how they're made and how they work and how they operate. So I go back to the end of that last question, which is to say, I hope in 10 years, we see more hybrid practices, more nonprofit practices, more social enterprises, more organizations that are really challenging a market-driven only capitalized system of construction and architects working across disciplines in unique and creative ways. I think that is one opening I hope will emerge. And then the last, I really do believe that, so that's our kind of structural problem in practice, but there's a moral problem, which is to wrestle with and challenge the idea that justice and beauty are two things that are not intertwined, that they are the same. If we hunt for one, we hunt for the other. And that if we believe beauty is not the search for justice, then we believe beauty is something you can purchase, something that only some can purchase, and then something that only some have access to. And that inequity in the very idea that what is beautiful is deserved by only a few that can pay for it, that is at the core of the rot of so many in the cultural disciplines that we have to wrestle with, and I think in architecture as well. So trying to solve for that will also, I think, blossom new practice models, blossom and inspire new designers to think critically about how they operate, and also and greatly change the built environment around us to be healthier, more beautiful, and more just, I would say.
That's great. And what a great conclusion. It's a reminder that the classic definition of design, which is changing the present situation to the preferred one, has all of these multi-facets to it. I want to thank our entire audience, wherever you are. I wish I could see you all for joining us. I hope you're as inspired as I was. And Michael, thank you so much. And I hope that everyone who heard this or who has managed to visit your website or buy the book will join us at the Building Museum when we're open to see some of this work in person.
Yeah,
So,
please do. Please join us. I'd love to share more with you. Please send us questions or emails. We're all available. We're so grateful for you spending this last hour and a half with us. And thank you, Susan, for this opportunity. It's great questions.
Okay. Thank you, and good night all.